Hi everyone, this is Revati. In this video, we are going to see about what are the immunoglobulin disorders. Let's talk about selective immunoglobulin deficiency. Selective immunoglobulin deficiency is usually inherited. It is nothing but it results in the low level of first type class of antibody immunoglobulin, even though the levels of other immunoglobulins are normal. The immune system produces several classes of immunoglobulins such as immunoglobulin A, IgA, IgD, IgE, IgG, and IgM. Each class helps protect the body from infection in a different way. Deficiency of one or more types of immunoglobulin increase the risk of serious infection. The level of any immunoglobulin class may be low, but the most commonly affected class is IgA. Selective IgA deficiency symptoms are result in the low level of immunoglobulin A. Levels of IgE and IgM are normal. Most people with selective IgA deficiency have few or no symptoms, but some have chronic lung infections, sinusitis, and other disorders. Doctor diagnose the disorder by measuring the level of immunoglobulins in the blood. Selective IgA deficiency is the most common primary immunodeficiency. It may be caused by a mutation in a specific gene or by a drug such as phenytoin used to treat seizure disorders or sulfasalazine used to treat rheumatoid arthritis. The inheritance pattern of the gene mutation is unknown, but having a family member with selective IgA deficiency increases the risk by about 50 times. Some people with selective IgA deficiency produce antibody against IgA if they are exposed to IgA in the blood transfusion or immunoglobulin, and which is the antibody obtained from the blood of people with a normal immune system. Rarely these antibodies against IgA trigger a severe allergic anaphylactic reaction the next time such people are given a blood transfusion or immunoglobulin. What are the treatment for this immunoglobulin disorders? Such as the doctors suspect selective IgA deficiency in people if they have recurring infections and anaphylactic reaction to a blood transfusion or to immunoglobulin, gastrointestinal symptoms that may result from inflammatory bowel diseases, family members who have selective IgA deficiency, common variable immunodeficiency or autoimmune disorders. Blood tests to measure immunoglobulin levels are done to confirm the diagnosis. Normally, the body's immune system responds to the vaccine by producing substances such as antibodies and the mobilizing white blood cells that recognize and or attack the specific bacteria or virus represented in the vaccine. Then, whenever the people who have been vaccinated or exposed to specific bacteria or the virus, the immune system automatically produces these antibodies and takes other action to prevent or lessen illness. People with IgA deficiency do not produce antibody in response to certain kind of vaccines. Doctors measure IgA antibody immunoglobulin levels before and after vaccination. Lack of increase in IgA after vaccination help to make the diagnosis. Treatment for this immunoglobulin disorders are antibiotics to treat or sometimes to prevent infection, use of medical identification bracelet or tag by people who have had an anaphylactic reaction to a blood transfusion or the immunoglobulin. Usually, no treatment of selective IgA deficiency is needed. Antibiotics are given to the people who have an infection. If the disorder is severe, antibiotics are given in advance to prevent the infection from developing. These are the immunoglobulin disorders. Thank you.